Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering emergency and mass casualty nursing, as well as triage nursing. If you haven't done so already, guys, please do not forget to like this video and subscribe to my channel if you haven't done so. Also, guys, don't forget that across the social media platforms, you can find me covering different content. So what I cover here on YouTube is different than what I cover over on TikTok, Instagram, and Facebook. So be sure to check out my content across the other social media platforms, as well as my podcast handle is still the same anywhere you go. It's Nexus Nursing. Okay, guys, without any further ado, let's get started. First question. Which is the most important goal of triage? A, assigning each client to the most appropriate treatment area. B, giving priority of care to the most critically ill or injured clients. C, providing a thorough assessment of the client. Or D, obtaining a complete history of the client's past medical surgical history. And guys, the correct answer is B, giving priority of care to the most critically ill or injured clients. That's what triage does. Okay, so as a triage nurse, your job is to get the person who's most likely to die, the person who's the sickest, to get them help the fastest. You want to get them evaluated and treated the fastest. That is your job of the triage nurse. And that's why A, C, and D are absolutely wrong. And you're moving like this because you're trying to get them in to go get evaluated and get treatment. So you're not going to sit there and be doing a long, thorough, evaluation. No, you're going to get them in to go be seen, and the nurse and the doctor will be evaluating that patient and treating that patient. Okay. Next question. What is the correct statement regarding the major role of the triage nurse? A, provide a thorough and comprehensive assessment of each client. B, be able to split and perform minor procedures. C, perform rapid assessment to determine priority of care. Or D, provide psychological support to family members. Okay, I inadvertently gave you guys the answer when I was talking to you about question number 1. So you all know the correct answer is C, perform a rapid assessment to determine priority of care. We got to figure out who's the worst off and get them seen immediately. Now let's look at the wrong answer choices. A, provide a thorough and comprehensive. No, this is you, because you're trying to get them in to go be seen to save their life, right? So that's wrong. B, be able to split and perform. No, let me tell you something. When you're a triage nurse, your only job is to get the sickest person in to be seen, okay? So you're not going to be doing anything else. Choice number D, provide psychological support. Nope, that's not your job either. Your job is to make sure that whoever's the sickest, it gets back there to see the nurses and the doctors and to get treated, okay? So the correct answer is C. Next question. A 22-year-old male arrives to the emergency department following a motor vehicle collision. He's not awake and is being bagged with a bag valve mask by paramedics. He has sustained obvious injuries to his head and face, as well as an open right femur fracture that's bleeding profusely. What should the nurse's initial intervention be? A, split the right lower extremity to decrease blood loss. B, apply direct pressure to the open area on the leg. C, assess for patent airway. Or D, start 2 large bore IV lines. And guys, the correct answer is C, assess for patent airway. Do we care about their fluid electrolytes? Do we care about their bleeding? Do we care about their circulation if they're not breathing? Absolutely not. So our first priority is going to be them breathing, ABCs. Remember, guys, when it comes to physiological integrity, you got to go back to Maslow's hierarchy of needs. What is physically keeping that patient alive? And there are some things in there: circulation, right? Having enough blood, fluid, electrolytes, breathing, all of those fall under physiological integrity. But then you have to take it a step further. You have to prioritize all of those. And what comes first? Airway. If that patient is not breathing, we're not going to care about their nutritional status. We're not going to care about their fluid electrolytes. We're not going to care about their vital signs. We're not going to care about circulation. We're not going to care about anything else if that patient is not breathing. Does that make sense? Yes, it does. All right, let's keep going. What statement best describes the basic concept of mass casualty triage? A, greatest good for the greatest amount of people. B, first come, first serve. C, women and children first. Or D, first priority to the most critical. And guys, the correct answer is A. the greatest good for the greatest amount of people. So this is a difference between mass casualty triage and emergency triage, right? When it comes to emergency triage, if you're the nurse in the emergency room or the emergency department, you're trying to get the sickest person in immediately. But when it comes to mass casualty, it's the opposite, just like it says. You want to do the greatest good for the greatest amount of people. So anyone who is most likely to die, you're going to leave them. You're going to go try to help the people who are more likely to live. Why? Because you're trying to save the most amount of people. And guys, I know it sounds heartless, but that's the reality. That's what it is in mass casualty nursing. So you absolutely must know the difference. If it's a mass casualty, the person who's most critical, that's not who you're going to go to first. You're going to go to the person who's most likely to live. You're going to try to save them. And the opposite is emergency triage nursing. In emergency triage nursing, the person who's worse off, that's who you're going to try to get in to be evaluated and treated. So guys, make sure you read very closely when you're reading the test questions so you can get the correct answer. A 67-year-old male presents to the emergency department complaining of chest pain. His heart rate is 120 beats per minute, blood pressure 100/68, and the respiratory rate is 20 breaths per minute. He's short of breath and diaphoretic. In a 3-tiered stage model, how should the nurse prioritize this client? A, emergent, B, urgent, C, non-urgent, or D, dormant? And guys, the correct answer is A, emergent. What does that mean? That means that this patient is in immediate danger of their life being threatened, of them dying. They are in immediate danger for a threat to their life or even a limb, okay? So that's the correct answer, A. Now let's look at the wrong answer choices. B, urgent. Urgent means that patient needs to be seen quickly, but their life is not in immediate danger as we are in A, which is emergent. C, non-urgent. Non-urgent means that patient can wait a couple hours. You have the patients that go to the ER because they have a nosebleed that has stopped bleeding. So they can sit there for a couple hours. They need to be seen, but they're not going to die. They can sit there for a couple hours. And then D, non-dormant. Well, guys, this tier is 3, okay? Which is your emergent, urgent, non-urgent. Dormant is not even part of the tier. It's nothing. They just made that up. So the correct answer, guys, is A. Which of the following statements are true regarding post-traumatic stress disorder? A, individual suffering from PTSD may display physical manifestations. B, professional burnout is rare secondary to PTSD. C, critical incident stress management is the only method to deal with PTSD. Or D, manifestations of PTSD are purely psychological. And guys, the correct answer is D. The correct answer is A. Individuals suffering from PTSD may display physical manifestations, such as what, guys? They may have tachycardia. They may suffer from insomnia. So PTSD is not only a psychological thing where the patient might have anxiety, they might have hypervigilance. They may also have physical symptoms. Again, like I said, tachycardia or insomnia or other physical ailments that the patient may have because of PTSD. Now let's look at the wrong answer choices. B, professional burnout is rare secondary to PTSD. That's false. Professional burnout is actually high, okay? Secondary PTSD. Choice C, critical incident stress management is the only method to deal with PTSD. What did I tell you guys about all-inclusives? Stay away from them. Always, only, never. Stay away from all-inclusives unless you know that you know that you know that you know that's the answer choice. This is wrong. Saying it's the only method, no, there are lots of different types of therapy and treatments for PTSD, so that's false. And choice D, manifestations of PTSD are purely psychological. When they say purely, that's another way of saying what? Only. Do we like all-inclusives? No, we don't. Okay, and that's false. Manifestations are not purely psychological. I just gave you examples of physical manifestations. So they may be physical, psychological, but most of the time, both. Okay, so that's why A is the correct answer. Next question. What is the highest priority of care in the pre-hospital setting for clients suffering from heat exhaustion after airway assessment? So we've assessed their airway. A, start IV fluids to hydrate the client. B, immerse the client in ice water. C, remove the client from physical activity and put him or her in a cool place. Or D, wait for paramedics to arrive and place the client in an air-conditioned vehicle. And guys, the correct answer is C. Remove the client from physical activity and put him or her in a cool place. Remember, guys, if you've been following me for any amount of time, I tell you this all the time. If something is offending the patient, something is making them sick, something is making them ill, remove them. Remove what it is that's making them sick or ill. So the first thing you're going to do is remove them from that heat, remove them from that physical activity, and put them in a cool place. Now let's look at the wrong answer choices. A, start IV fluids to hydrate the client. Yes, you want to hydrate the client, but let's think about this for a moment. The first thing you do after you assess that patient's airway is give them IV fluids. So you're going to be giving them IV fluids while they're still suffering from that heat exhaustion, while they're still in that place with the heat. Does that make any sense? Absolutely not. So yes, we're going to want to hydrate them, but we're going to first want to take them away from whatever is offending them. Choice B, immerse the client in ice water. Oh, so now you're trying to make them hypothermic. Does that make any sense? Absolutely not. Choice D, wait for the paramedics to arrive and place them in an air-conditioned vehicle. Really? So you're going to keep them in that heat while we're waiting for paramedics to arrive when we had a beautiful choice of removing them from that heat and putting them in a cold place? Guys, come on. Get it together. So the correct answer is what? C. Very good. Moving on. A client has suffered a snake bite, North American pit viper, to a lower extremity. What would be the most appropriate nursing intervention? A, apply ice to the bite immediately. B, attempt to capture the snake for later identification. C, immobilize the extremity in a position of function. Or D, incise the bite and suck out the venom. And guys, the correct answer is C, immobilize the extremity in a position of function. So what is that position of function? You're going to have that leg down, okay? Way down below the level of the heart. Why? You want to decrease the rate of that venom spreading, okay? You want to limit the spread. Now, let's look at our other answer choices. A, apply ice to the bite immediately. That's not going to do anything. That's what you do for a spider bite, right? Not a snake bite. That venom is going to spread. You want to just slow down the rate of spreading until the patient can get emergency help. Choice B, attempt to capture the snake for later identification. So here we have this patient who got a venomous snake bite, and you letting them die while you out here looking for the snake. What kind of sense does that make? Stop it. Choice D, incise the bite and suck out the venom. See, if you're watching my video, I know you're not stupid because you're watching me. So there's no way that any of you guys would have chosen D. There's no way you would put your mouth on that bite and suck it out of the patient. In what world? So guys, the correct answer is C. Very good. I'm so proud of you guys. You guys are doing wonderful. Wonderfully. You guys are doing wonderful. You guys are doing wonderfully. Is wonderfully a word? I don't know. Let me know in the comment, guys. Okay, next question. The primary first aid intervention in the pre-hospital setting for a black widow spider bite is the application of ice. Okay, we just talked about that. Which statement provides the best rationale for this intervention? A, ice inhibits the action of neurotoxin. B, ice reduces swelling from the affected extremity. C, ice decreases venous return from the affected extremity. Or D, ice decreases the pain associated with spider bites. And this is a tricky question, but I hope you guys all got it. The correct answer is A. It really does. It inhibits, which means to stop. It stops the action of the neurotoxin. Okay, so it actually stops, it prohibits what is actually harming the patient. That's why we put ice. Now, you see choices B, C, and D. All of these are true statements. These are absolutely true. But the rationale, the reason that we put ice is because of A. Okay, and test writers will do that to you guys. They will put as answer choices, they will give you true statements, but you have to always ask yourself, does this answer my question? So yes, this statement is true, but is it true for my question? Is it answering my question? And the only one that answers the question to this is question A, choice A, which is inhibits action of neurotoxin. A 27-year-old woman arrives to the emergency department after being struck by lightning. After successful resuscitation, what laboratory findings might the nurse expect to be ordered? A, normal CBC, decreased creatinine and BUN levels. B, elevated CK, BUN levels, and hyperkalemia. C, normal CK and BUN, hypokalemia. Or D, normal CBC, normal creat, and elevated BUN, hypokalemia. And guys, the correct answer is B, elevated creatinine kinase and BUN, hyperkalemia. So let me explain this to you guys. The elevated CK and the hyperkalemia, that comes from the skeletal muscle damage. Remember, just like a patient who has a heart attack, they have an MI, we're going to see that CK go up. We may see that potassium go up. Why? Because there's been damage to the muscle. So that person who's been struck by lightning, they're going to have severe damage to the muscle. So we're going to see that CK go up. We're going to see that potassium go up. The patient may have hyperkalemia. Let me tell you why. We'll see the BUN go up. We'll see the creatinine go up. We'll see the urine output go down. Let me explain that part to you. The reason, and that wasn't part of the answer choices, but I'm just telling you so you can know, okay? The reason for that is because something like lightning strike, which is severe, it will cause severe muscle damage. What happens is the patient will end up having a whole bunch of myoglobin in the bloodstream. Well, the blood gets filtered by the kidneys, right? And so you end up seeing all that myoglobin in the urine. And so it affects the kidneys. It affects the kidneys. And that's why you'll see the creatinine go up. You'll see the BUN go up. And you'll see the urine output go down. Okay, so that's why. So guys, the correct answer is choice B. Which of the following clients listed below would be most susceptible to hypothermia? A, 17-year-old female with type 2 diabetes. 2, 10-year-old female with asthma. C, 56-year-old male with a history of alcohol and tobacco use. Or D, 76-year-old male with hypertension. And guys, the correct answer is C, the 56-year-old male with a history of alcohol and tobacco abuse. So guys, risk factors for hypothermia are patients who are homeless because obviously they don't have shelter, so they'll be out in the cold. Patients who are malnourished, just like this says, alcohol and tobacco. Patients who have decreased nutrition. Patients who are excessively fatigued. Patients who have decreased peripheral circulation. All of those types of patients are at risk for hypothermia. So that's why C is the correct answer choice. What is the least effective rewarming method? A, warm peritoneal lavage. B, warmed enemas and IV fluids. C, warmed humidified oxygen via face mask. Or D, warm blankets covering the entire body. And guys, the correct answer is warmed blankets covering the entire body, D. Why? Remember, if you guys have been following, if you've been following my playlist for NCLEX prep, you'll see I talk about this all the time. When you don't know what the answer is, look at your choices. And if it's a multiple choice, say to yourself, what do all three have in common? And is there an opposite? And whichever is the opposite, that's going to be your answer. So let's say you didn't know what the answer choice was. Looking at A, B, and C, you should have said to yourself, well, with A, B, and C, all of these are what? Things that go into the body. These go inside of the body. D is the only one that is on the outside of the body. And that is exactly why that's the answer. Because with A, B, and C, the patient's getting core rewarming. It's going inside of the patient's body. But choice D, they're only getting body surface rewarming. We're only warming the body surface, but we're not warming the core, the inside of the patient. And that's why D is the correct answer choice. Okay, next question. The key factor in the pathophysiology of a near drowning in salt water is that aspirated water, A, flushes surfactant out of the lungs, B, causes an osmotic gradient that draws water into the alveoli, C, decreases lung compliance, or D, increases the work of breathing, leading to hypoxia. And guys, the correct answer is B, causes an osmotic gradient that draws water into the alveoli. So guys, salt water is hypertonic, okay? Remember, tonic, tonicity has solutes. What are the solutes? The salt. Okay, so salt water is hypertonic. So what happens is it pulls, it draws all of that protein-rich blood that's supposed to be floating in the vessels. It pulls it into the alveoli where oxygen and carbon dioxide gas exchange is supposed to happen. And guys, that's why B is the correct answer. Don't forget, remember, hypertonic, think of tone, tonicity, solutes. Okay, and salt absolutely is a hypertonic solution, and it's going to pull the fluids. Oh my gosh, we're already down to our last question. Oh, you guys are going to be mad at me. I can already see the comments. I'm so sorry, guys. I'm going to make sure I make the next video a little bit longer for you because I already see it coming. All right, guys, last question. Predisposing conditions that promote the development of hypothermia include which of the following? Select all that applies. All right, guys, how do we treat select all that applies? As true or false? Let's go. A, cold water from immersion. True. Obviously, guys, that's going to make them cold. It can cause hypothermia. Absolutely. I actually gave you the answer to that in one of the other questions we did. B, obesity. False. If the patient's obese, they got a lot of fat. That fat's keeping them warm. They're not at risk for hypothermia. Choice C, low birth weight. Nope, that doesn't place them at risk for hypothermia either. D, shock. Absolutely. When you're checking a patient and patients, their skin's nice and warm, I can't speak. What actually are you feeling? What's making their skin nice and warm? The blood. So if a patient starts losing blood and their body's going through shock and the organ starts to break down, they're going to feel cool because of that what? Loss of blood. That blood's what's keeping them warm. So absolutely true. Shock is a risk factor for hypothermia. E, cold weather. Cold weather. True. Absolutely. That's a risk factor for hypothermia. F, extremes of age, being really young or really old. No, that doesn't put them at risk for hypothermia. G, I cannot speak. Alcohol intoxication. True. Absolutely. Absolutely, guys. I talked to you guys about this in another question. I don't remember which one, but it's true. Let me explain to you the rationale because I don't think I talked to you about that. The reason this happens, guys, is the vasodilating effect causes them to lose heat. They have heat loss through radiation, okay? And so that's why being intoxicated with alcohol can place them at risk for hypothermia. H, malnutrition. True. If a patient is malnourished, remember, your body is meant to survive no matter what. So if you're malnourished, your metabolic, what's the word I'm looking for? Your metabolic rate goes down because it's trying to conserve the little bit of vitamins and fluid electrolytes and everything else that you have. It's trying to conserve it. So the metabolic rate goes down. Well, I want you to think about that, guys. If your metabolic rate goes down, what else is going to go down? Heat production. Think about it. If I go running, right, I'm running, my metabolic rate is going to increase because I'm using those muscles. Those cells are working, right? They need to be fed. So I'm producing what? Heat. But the more that the metabolic rate goes down, the less heat I'm producing, and it can place the patient at risk for what? Hypothermia. I hope that makes sense. And last, prior history of trauma. No, that's not a risk factor for hypothermia. So the correct answer choices are cold water immersion, shock, cold weather, alcohol intoxication, and malnutrition. Guys, I hope that you found this video to be helpful. If you want to see more content, more videos on triage nursing or mass casualty nursing, please just leave me a note in the comments and I'll make sure I produce more of those videos for you. Thank you so much for spending this time and watching my videos, guys. Thank you for the interaction. You guys actually, when you leave comments and when you like my video, you really increase my score with the algorithm, so my videos are pushed out to more people, and that really is helping my channel to grow. So I can't thank you enough. I'm asking you, please continue to comment, continue to like my videos, continue to share my videos on your social media platform to help my channel grow, and in that way I can produce more videos for you guys. I want to get to the point where I'm producing 2, 3, 4 videos a day. That's going to help you guys more. So I'm asking you, help me to help you. All right, guys, that's it. Don't forget to like and subscribe below, and you'll be seeing me on the next video.